Then we have the chemical mediators of inflammation. Herein we have the mediators which are cell derived, and we have mediators which are the plasma derived. In that we have the preformed mediators that consist of histamine and serotonin. This is very commonly asked MCQs. Histamine, they are secreted by mast cell, basophils and platelets. This is an MCQ. While serotonin is secreted by platelets. Then we have the newly synthesized, in that we have the prostaglandins, leukotrienes, PAF, reactive oxygen species, nitric oxide, cytokines, etc. Then we have the complement activation and complement systems that acts as C3A, C5A as anaphylactic toxins. We have C3B, C5B to 9 which act as membrane attack complex. Then we have the kinin system and the coagulation system that also plays a role in inflammation. This is a list and the principal action of the cell-derived mediators and their source. We have seen that neutrophils, they are the primary players of the acute inflammation, but based on the type of infection, the inflammatory cell varies. And here we can see that we have the acute bacterial infection and abscess, the prime inflammatory cells are neutrophils. While when we talk of the chronic infection, the prime cells are macrophages, the plasma cells and the lymphocytes. Whenever we have a parasitic infection, we have eosinophils coming into the picture, which is also a scenario in allergy. In viral infection, the prime cells are lymphocytes. We talk a little about tissue macrophages here. The tissue macrophages are nothing but the monocytes that have reached the tissue. In the tissue, they are called as macrophages, and they have different names in different kinds of tissue. And we have included this slide here because again, this is a very common source of MCQ. In the connective tissue, these macrophages are called as histiocytes. In the nervous system, they are called as microglial cells, or you can say only the glial cells. In the epithelium, they are called as the Langerhans cell. In the lymphoid tissue, they are called the dendritic cells. Lungs, they are called as alveolar macrophages. At this point, do you remember the heart failure cells? Which are nothing but hemosiderin-laden alveolar macrophages. Alveolar macrophages had ingested the extravasated blood. Then in liver, we have the Kupffer cells, and in granuloma, these cells are called as epithelioid cells. Next, we talk about the granulomatous infection. When an initial acute inflammation is not digestible by neutrophils, the mechanism that deals with such a scenario is called as the granulomatous infection. And the principal cells of granulomatous infection are macrophages and lymphocytes. We'll see about the few important granulomatous diseases. In that, the most important one, we have the tuberculosis. And the primary infection of the tuberculosis, it is called as Ghon's complex. It is seen in the individual which have not been immunized or who have not been previously infected. And this Ghon's complex occurs between the upper and the lower lobe. If you talk about the lobes of the lungs, the left lung has 2 lobes, while the right lung has 3 lobes. And this Ghon's complex, it occurs between the upper and the lower lobe. Primary infection, if it happens in the intestine, it is called as Stapes mesenterica. If the infection spreads through the blood vessels and multiply, it is called as miliary tuberculosis. And what is lupus vulgaris? It is a primary infection of the skin. Primary TB infection, tuberculosis infection of the skin. The secondary lesions are called as a Simon's focus, and usually they are found at the apex of the lungs. If this mistake is there in the keynote as well, please correct it. Then we have the soft tubercle or granuloma with the central caseous necrosis, which is a typical of the tuberculosis. And BCG vaccine, it contains attenuated strains of the bovine type of tubercle bacteria. We are just compiling up the key points over here. Scrofula. What is scrofula? Scrofula is the inflammation of the lymph nodes, tuberculous infection of the lymph. The next major disease, granulomatous disease, is the leprosy. In that we have the lepromin test, which is a very common source of MCQ. Herein what is done is the intradermal injection of antigenic extract of M. leprae are given. An early positive reaction, it is called as the Fernandez reaction, while the delayed positive reaction, it is called as the Mitsuda reaction. And what it tells us is the hypersensitivity of the patient to the antigen. With this we complete this part of the discussion, and when we talk about general pathology, it is a huge subject and we are trying here in the class to cover up the basic concept, but we need to go a long way with reading MCQs and back referring these MCQs into the standard textbook, and the book of reference has to be nothing other than Robbins. Thank you.